తలనొప్పి, నరాల బలహీనత, మూర్ఛ వ్యాధి, పక్షవాతం, బ్రెయిన్ స్ట్రోక్, బ్రెయిన్ ట్యూమర్స్, మెడ, వెన్నెముక సమస్యలు, పక్షవాత సమస్యలకు పరిపూర్ణ వైద్యం. మన దేశంలో ఎక్కడా లేని ఆపరేషన్ థియేటర్, అమెరికాలో జరిగే వైద్యం ఇప్పుడు గుంటూరులో. చిన్న కోత ఆపరేషన్ల ద్వారా కేవలం 2 రోజుల్లోనే డిశ్చార్జ్. డాక్టర్ రావ్స్ న్యూరో హాస్పిటల్, గుంటూరు. సంప్రదించండి 9010056444, 9010057444.
Join Dr. Rao, the leading neurosurgeon, in a compelling Q&A session that uncovers the world of minimally invasive neurosurgery and spine surgery. Gain valuable insights into the advantages of these advanced techniques and their transformative impact on patients' lives. What are minimally invasive neurosurgery and spine surgery? Minimally invasive neurosurgery and spine surgery are surgical techniques that use small incisions, specialized instruments, and advanced imaging to access and treat various brain, spine, and nerve conditions. Compared to traditional open surgery, these techniques aim to reduce damage to the surrounding tissues, blood loss, infection risk, pain, and recovery time. What are the advantages of minimally invasive neurosurgery and spine surgery? Some of the advantages of minimally invasive neurosurgery and spine surgery are: better cosmetic results from more minor scars, less blood loss and transfusion need, less muscle damage and inflammation, less postoperative pain and medication use, faster recovery and return to normal activities, shorter hospital stay and lower cost, lower risk of infection and complications. What are the disadvantages or limitations of minimally invasive neurosurgery and spine surgery? Some of the disadvantages or limitations of minimally invasive neurosurgery and spine surgery are more incredible technical difficulty and learning curve for the surgeon, longer operative time in some cases, limited visualization and access to some areas of the brain or spine, higher cost of equipment and instruments. What conditions can be treated with minimally invasive neurosurgery and spine surgery? Some of the conditions that can be treated with minimally invasive neurosurgery and spine surgery are brain tumors, aneurysms, hydrocephalus, trigeminal neuralgia, pituitary tumors, skull-base tumors, spinal stenosis, herniated discs, degenerative disc disease, spinal deformities such as scoliosis or spondylolisthesis, spinal fractures, spinal infections, spinal tumors. How is minimally invasive neurosurgery and spine surgery performed? Minimally invasive neurosurgery and spine surgery can be performed using different techniques depending on the condition and location. Some of the standard techniques are: using a tubular retractor to create a small tunnel through the muscles and soft tissues to reach the spine or brain, using an endoscope or microscope to visualize the surgical site through a small incision, using a robot or navigation system to guide the instruments and implants with high precision, using lasers or radio frequency to ablate or coagulate tissues. Who is a candidate for minimally invasive neurosurgery and spine surgery? Not every patient or condition is suitable for minimally invasive neurosurgery and spine surgery. The decision depends on several factors, such as the type, size, location, and severity of the condition, the patient's age, health status, medical history, and preferences, the surgeon's experience, skills, and equipment availability. The best way to determine if you are a candidate for minimally invasive neurosurgery and spine surgery is to consult a qualified neurosurgeon like Dr. Rao, who has experienced both open and minimally invasive procedures, can evaluate your condition and discuss your options. What are the risks or complications of minimally invasive neurosurgery and spine surgery? As with any surgical procedure, minimally invasive neurosurgery and spine surgery have some risks or complications that may occur during or after the operation. Some possible risks or complications are bleeding, infection, nerve damage, spinal cord injury, cerebrospinal fluid leak, implant failure or migration, hardware malfunction or breakage, and recurrence or progression of the condition. What is the recovery process after minimally invasive neurosurgery and spine surgery? The recovery process after minimally invasive neurosurgery and spine surgery varies depending on the type and extent of the surgery. In general, patients can expect to have less pain and discomfort than after open surgery. They may also be able to resume their normal activities sooner. However, they still need to follow some instructions from their surgeon, such as taking prescribed medications for pain relief and infection prevention, keeping the incision site clean and dry, avoiding strenuous activities such as lifting heavy objects or bending, wearing a brace or collar if needed, attending physical therapy sessions if recommended, following up with their surgeon regularly. How do I choose a good neurosurgeon for minimally invasive neurosurgery and spine surgery? Choosing a good neurosurgeon for minimally invasive neurosurgery and spine surgery is an important decision that can affect your outcome. It would be best if you are looking for a neurosurgeon who has board certification in neurological surgery, fellowship training in minimally invasive neurosurgery or spine surgery, experience in performing the specific procedure you need, access to advanced equipment and facilities, good reputation and reviews from previous patients, good communication and rapport with you. You will find all these qualities in India's best minimally invasive neurosurgeon Dr. Rao, who is working at Dr. Rao's hospital. What are some myths and facts about minimally invasive neurosurgery and spine surgery? Some of the common myths and facts about minimally invasive neurosurgery and spine surgery are: myth. Minimally invasive neurosurgery and spine surgery are experimental or unproven. Fact. Minimally invasive neurosurgery and spine surgery have been developed and refined over the past decades and proven safe and effective for many conditions. They are supported by scientific evidence and clinical guidelines. Myth. Minimally invasive neurosurgery and spine surgery can treat any condition or patient. Fact. Minimally invasive neurosurgery and spine surgery are unsuitable for every condition or patient. Some conditions may require open surgery or a combination of techniques. Some patients may have contraindications or preferences that prevent them from undergoing minimally invasive neurosurgery and spine surgery. Myth. Minimally invasive neurosurgery and spine surgery have no risks or complications. Fact. Minimally invasive neurosurgery and spine surgery have lower risks and complications than open surgery but are not risk-free. They still involve cutting, drilling, implanting, or ablating tissues that can cause bleeding, infection, nerve damage, or other problems. Patients should be aware of the potential risks and complications and discuss them with their surgeon before the surgery. Myth. Minimally invasive neurosurgery and spine surgery guarantee a quick and easy recovery. Fact. Minimally invasive neurosurgery and spine surgery can shorten the recovery time and reduce the pain and discomfort after the surgery, but they do not eliminate them. Patients still need to follow their surgeon's instructions, take medications, avoid certain activities, wear braces or collars, attend physical therapy, and follow up with their surgeon. The recovery process also depends on the patient's condition, health status, age, and lifestyle.